And just confirm when we have the recording notification.
Received it.
Okay, fantastic. All right, so welcome everyone. Thank you for joining. We are going to go over a community-led mini grant opportunity presented by the Frederick County Health Department. My name is Danielle Haskin. I'm the Director of the Equity Office for the Frederick County Health Department. I'm here with my partner, my co-team member, Natasha Kavanaugh, who's our grant administrator. And so she's going to take you through details of the mini grant opportunity beyond diet and exercise.
Thanks, Danielle. If you can move to the next slide, we'll go over the agenda and what we will cover. So you will see we will cover some of the key information about the grant program. So who's eligible to apply, the key dates, and the requirements. We also will provide application tips and where to find more information. And at the end, we will take your questions, but please feel free, if you have questions throughout the session, to put those questions in the chat as well. Next slide. Just to give a little context for why we put out the request for proposal, over 65% of adults in our county are overweight or obese. The evidence indicates that women and teenage girls in particular, and Black and Hispanic females are disproportionately impacted. And we all know that obesity can contribute to the onset and increase the severity of various chronic diseases and can negatively impact our quality of life. So we know that achieving and maintaining a healthy weight really is important to disease prevention and overall health. And that's why we are seeking your help. So we'll talk a little bit about the funding priorities. Although activity levels and diet are critical, body weight we know is also affected by many other factors, including stress and sleep. So that's why we are looking to fund community organizations that promote and support healthy weight goals of county residents. So we're looking for activities that include more than just diet and exercise. Some examples could include the creation of peer groups for healthy eating. It could include creating a community garden or promoting healthy mealtime rituals, screening for abnormal glucose levels. And these are just examples because we really look forward to reviewing the creative ideas that you come up with, but the point really being that we are looking for projects that intentionally move beyond diet and exercise. The next funding priority is community level interventions. So a lot of times there are many ways that when you think about being overweight or obese that you can focus on individual solutions. We're really looking for those community level interventions. And one of the examples I just provided really illustrates that, like promoting or creating a community garden, for example. So really looking to get the whole community involved. Next one, thank you. Evaluation of outcomes. So when I want to make sure that this doesn't sound scary. When I talk about and when the application mentions evaluation of outcomes, we just want to make sure that the organizations track whether or not they're successful. So it doesn't have to be a robust evaluation of outcomes, but if you have any questions about what qualifies, feel free to reach out to us. Various community actors involved. So again, going back to community level intervention, but also making sure that various community actors are involved. So it could be individuals, schools, businesses, nonprofit organizations, just again, taking a community-based approach. We also want to make sure that your project really focuses on or is done in collaboration with other events. So when you think about other events, we're thinking about things like National Physical Fitness and Sports Month or Women's Heart Week, or it could be other holidays. If you have some activities that are tied to these meaningful cultural events or community moments. And of course, we're also looking for projects that are feasible, again, that are community-led, meaning that community members have either designed or otherwise want or are eager to participate in the planned activities. So again, that collaboration with various types of community members. Also the equity focus, given as I mentioned at the top, that women and teenage girls, particularly Black and Hispanic women, are disproportionately likely to be overweight. We are particularly keen to fund projects that focus on this demographic. And again, this is based on the data specific to our county. Next slide, please.
If I could just add in a quick comment, thinking through, I love that you provided suggestions, right, for some of the interventions or programs. But keeping in mind and thinking through, as you mentioned, sustainability and making sure the community is involved, there's not a need to create something new. We know there are so many fantastic things going on. It's one of the things I love about Frederick County currently. So if there is something that you're currently doing that can be supported through these funds, that's absolutely an option too. And almost in some sense, thinking about sustainability and what happens when these funds run out, you can continue your program because it's something that you're already familiar with and that you're already doing.
Perfect, thanks, Danielle. Slide. Again, just a quick facts here, funding availability. So we are planning for about 10 grants up to $10,000 each, depending on the resources that might be available. So again, it's up to $10,000 based on the needs of the project, and the amounts are subject to change. The grant period is roughly from October 1st through May 31st of next year. And we'll turn it to you, Danielle, to talk about the disbursement of grant funds, because I think one of the unique things about this grant opportunity is the way that it can be funded.
Absolutely. And really wanting to be intentional when we have conversations about equity and what does equity mean, and supporting community-led initiatives. We understand that our community organizations are of all sizes, shapes, and sizes, and so sometimes it's really hard to get the funding, the capital, the seed money, whatever you call it, to get things started. Or even to expand, like as I mentioned, something that's already going on. So the disbursements of grant funds for this mini grant, we will do a 50% disbursement upfront to address some of that challenge. So up to $5,000 will be dispersed upon award and contract signing for what the needs that you identify in your proposal, and then the second 50% will be reimbursement based, and that will invoice based, which is reimbursement based. There are a couple of ways that you'll get funded, but there'll be 2 deposits.
Thanks. Next slide. Quickly, who's eligible to apply? Basically, anyone that serves our county residents. So organizations that are either community coalitions, whether you're incorporated or not, nonprofit organizations, faith-based organizations, and small businesses. Again, if you have a question about your status and whether you are eligible to apply, I encourage you to reach out to us. Next slide. And again, just to reiterate, the closing date, August 6th at 11:59 p.m. You can submit applications via email. And again, if you have questions in completing the application, feel free to reach out, but the deadline is August 6th. Next slide. I want to talk briefly about the application review process and what we are looking for. We kind of went through it at the beginning, but just want to recap it here. So this is open, competitive application process. We encourage many applicants to apply. And we talked a little bit about what the review panel is looking for. Danielle highlighted some of those things as well, including sustainability. So whether you intend to continue the project after the grant period, whether there is a focus on equity, particularly those members of our communities that are disproportionately impacted by obesity and some of the chronic diseases that can be impacted by obesity. We really want this process to be easy and really open to all who are interested in applying. So for that reason, no need to include unrequested or extra information. We are intentionally trying to have a very streamlined process. So again, if you have questions about what's required or what needs to be submitted, please do reach out to us. Next slide. I wanted to briefly touch on the budget form. The budget form and all of the information is included on the Frederick County Health Department website, but wanted to highlight, you will also find what we call Form 440 on the website. I wanted to just show briefly what that looks like here. It just asks for some pretty basic information, financial information, budget information for the planned activities. So it's in an Excel format. We ask that you just complete the first tab, which appears here on the screen. And again, if you have any questions about completing the budget form, please do reach out, because we don't want it to be a barrier to organizations who want to apply. So we are here to help you complete the form. And it is quite possible that some of the sections might not be applicable to your organization. So if it's not applicable, please don't feel the need to complete it. And again, before you do work, feel free to reach out to ask any clarifying questions. And Danielle, I don't know if you want to add anything there as well.
You added everything that I was thinking. So yeah, just to reiterate, sometimes this part can be scary when it talks about some of the insurance and some of the different payment things that may not even apply to your organization. So first and foremost, I think, Natasha, you hit that home well. Reach out. We are here to be a resource. We want to be. If you have any questions about what does apply and what doesn't, that's most important.
Thanks. This is our tentative grant timeline. So we do expect to notify the award recipients by September 18th, and then announce to the public all of the grantees by October 1st. Again, the dates are subject to change. And here are some of the post-award requirements: a grant agreement or letter, and just a final report. Again, we're trying to intentionally keep the process pretty streamlined, but we will request a final report. We will offer grantee cohort sessions. So these sessions will give you an opportunity to meet other grantees and to also build relationships and potentially collaborate with those other grantees. But we also will offer educational and support information that might be helpful, not only for this particular grant, but also just for organizational capacity going forward. Program monitoring. I know most organizations, if you are implementing a project, you will also monitor those results. And as I talked about, at least measure some of those outcomes and whether or not the planned activities achieved the intended outcome. And then we will have some publicity language that's required, because some of the grant funds are being provided by the state of Maryland. So it's a requirement, but we will provide that exact language to the award recipients. Danielle, anything else to add here on the post-award requirements?
Nope. Again, I think you covered it wonderfully.
Good. Thanks. Next slide. I think the next slide just shows more information on where to find more information on our Frederick County Health Equity website. We will update. We have a frequently asked questions section. So as we receive questions from applicants, we do update that document so you can find up-to-date information there, the grant program information, and any updates or announcements. And then I think the next slide just shows, again, if you have any questions, feel free to reach out. By email is the best way to reach out, and we do respond really quickly. So again, before you spend any time working through either the budget form or the application, please do reach out, because we are here to help. And now I'm happy to take any questions, or Danielle, if you have any other remarks that you'd like to add.
Just to add in, I know I'm grateful to be involved in the community. And so sometimes I know I have been receiving emails about the grant questions. And so as I've been forwarding them to you, Natasha, I just wanted to kind of reiterate that the quickest responses you'll be able to receive by emailing this address, fchdequityoffice@frederickcounty.gov. That way there are multiple people kind of monitoring and able to respond to you. So your resources are increasing.
And maybe we can just open it up to see, if there are any questions, happy to take them.
So going back to when you said who could apply and you said Frederick County residents, it sounded like all of those were either business or organizations. Can individuals apply, or is there a certain criteria to be a business nonprofit entity?
That's a really good question. I'm thinking through on the fly. I'm pretty sure it does have to have a designation of some sort, because we would need some sort of tax ID. So it would. But to that point, right? Because there are quite a few interest groups or really just passionate individuals who may be interested. So we're happy to kind of talk through that and possibly sharing this information with an organization that aligns with what the person wants to do. Kind of the idea that the person had, that's a possibility and one way to collaborate as a solution. Really good question, though. And I'm not hearing any other questions, I think. So like I said, we will make sure that this recording is posted on the health.frederickcountymd.gov website. In addition to being posted on the social media accounts. That way it is there for you to see in a couple different ways. But if you take nothing away at all from this presentation, please, we are here as a resource. Reach out. So before you put a lot of hard work into it, we know how valuable your time is, how passionate everyone in our community is. We are here to answer questions. And there's also that community practice and the body of knowledge that can be built. If you have a question, somebody else may also have it. So. Thank you for joining us, everyone. And thank you, Natasha, for walking through.
Yeah, thank you, Danielle. Thanks, everyone. Bye-bye.
Bye.